All right, good afternoon, everyone. We're going to go ahead and get started. I'm Susan Hickman. I am the director of the IU Center for Aging Research here at Regenstrief, Regenstrief investigator and a professor in the School of Nursing and in the School of Medicine. It is my great pleasure to be here today to introduce two of our IU CAR investigators. And those are Dr. Malaz Boustani and Dr. Kathleen Unroe. They're both in the Division of General Internal Medicine and Geriatrics. And when we were talking about sessions that we might pull together in planning for the REILS talks this year, I had proposed that we invite Malaz and Kathleen to share their experiences with taking their research findings and translating those into business opportunities to support dissemination and implementation of the really great science that undergirds the work they do. And both agreed, and we were able to find a date that worked for both. They have informed me that they have kept their content short, and their goal is to leave 30 minutes for question and answer. So they did assure me they have other things they could say, but they really want this to be interactive and engaging. So I encourage you to be thinking actively during their presentation about what kinds of questions you have, about what they're sharing or how it might apply or how you might follow in their footsteps. So with that, I'm going to turn the floor over to my dear colleague, Dr. Kathleen Unroe.
We are going to focus on keeping this as tight as we can to leave time to take this conversation in any direction that you guys are interested in taking it. But I could talk about Probari and Optimistic all day, so it won't be, we'll have plenty to say, but we're going to try and keep this a little shorter to start with. So this is the official disclosure slide, which discloses the topic of the day, which is my ownership interest in Probari, and Malaz's disclosure slide as well, which again covers some of the topics of today. So some of our learning objectives here, just things that we want to make sure we cover, is give some examples of this journey, this continued journey of building up a new startup, moving an idea, and not just an idea, right? Because when you're coming from research to a business, you're not starting. In fact, I feel like I've said this a few times, not like out in my garage just trying to build something here. Like we have a foundation here. We have something we're working with in research, trying to bring it into a startup into existence. It is a journey. So we'll talk through a few examples of that, which hopefully again we'll get some questions going. You can't talk about this world without talking about money and talking about fundraising, including grant mechanisms. So we'll hit that, but that's a great area to dive into more if you're interested. Talk about the role of startups within the research mission of academic institutions. And I know, and we're always talking about impact on populations, and impact on public health. And I know Malaz will talk about that too, but that certainly underlies a lot of our motivation here. So this was the little disclosure slide I made before they gave me the more official one. But the first thing I want to say is don't be afraid of this slide. So I had so many years where I would do all these talks and be disclosures, nothing to disclose, so easy, right? But now I always have something that I'm disclosing because I have this ownership and leadership interest in Probari. So I disclose it every time I publish a manuscript. I disclose it every time I give a talk, to the university, et cetera. So don't be afraid of that, though. I met with attorneys prior to founding the company at IU, and they first of all they said a couple things. One thing they said was thank you for meeting with us before there's issues and concerns, and the other thing they said is conflict of interest can be managed. It can be managed, and it needs to be managed, but you have to be out in front of it. It's your responsibility, and lots of transparency. So I can talk more about that particular aspect of it, but that stops some people in academia from going into this world, and so I just wanted to name it. So where are we starting from? So Optimistic. So hopefully a lot of people here have heard of Optimistic, and there are definitely some folks in this room who worked on Optimistic. But Optimistic was the coolest project I'm probably ever going to get to do. And I got to do it right after I landed here at IU. It was an 8-year-long, 2-phase Centers for Medicare and Medicaid Services clinical and payment demonstration project. It ended up being an over $30 million, a $30.3 million investment in trying to reduce avoidable hospital transfers among nursing facility residents. And we were one of 7 sites in the country who got to do this project. And this is, the nursing facility partners. So we had 40 nursing facility partners directly involved participating in this project, a lot of other partners as well, academic, state government, and others. So just very briefly, because I think it's important to say what Optimistic was, because I'm going to tell you what Probari is, and you will see the differences and the transformation that occurred taking this project that was, it was born in an implementation space, but still in our research academic space, and then what it became. So we embedded nurses, people in each of these buildings. In almost every building, they were full-time embedded in the building. And then we had nurse practitioners as well who were providing additional clinical support. And we designed a novel role for them that was more proactive, trying to address the many drivers of avoidable hospital transfers and improve quality. Okay, and I'll just cut to the chase, cut through 8 years and just tell you that Optimistic worked. So exciting, it worked. We reduced potentially avoidable hospital transfers by 1/3. We saved Medicare money. And so, it was a rude awakening over years that CMS wasn't just gonna scale it up. The promise of the Innovation Center, apparently it's a lot more complicated than that. And so Optimistic worked, and then there was not going to be a mechanism to continue it unless we took it into our own hands. So to take what this large team, and I had fun kind of digging through the archives and finding some old pictures, to take what this large team had done and transform it into a business, again, there were a lot of steps. Now, one important thing I'll say is when we started Optimistic, was starting a business on our minds at all? No. It was not. It was not on our radar. This really was a journey of figuring out, we've got something here, we've got something that we want to take forward. CMS isn't just going to do it. There was some sort of maturing and realization through that process. Now, I've talked to other people who start their project with a plan that this is a likely path. And then you build differently. And then, you make different choices. So we did not do that. We were just trying to solve the problem and, using all those resources, et cetera. And what we did worked, transforming it into a product or service that can exist in a marketplace environment. It's a different animal. And it has been a big transformation to get us to Probari. Oh, I should have pointed out Russ. I don't know. Oh, was someone chiming in? Okay. So Russ, he's in the upper right corner there. Russ is a nurse, Russ Evans, who was one of the very first nurses hired for Optimistic, and was the manager for all the clinical staff in the project. And Russ and I then co-founded, initially we called it Care Revolution, and ended up changing the name to Probari. Probari is a Latin word that means proven. So throughout, even though, again, Probari, what we do now looks different from where we started, we are very mindful of our academic roots and where we came from. I just want to briefly say what Probari looks like right now. So we are a tech-enabled care model. And Probari is a team of nurses who now work virtually to do clinical reviews, climb into the medical records of nursing facilities and do clinical reviews around transitions of care, infections, and around other quality improvement targets. You can see now how different that is, though, than the Optimistic clinical care model, where we embedded specific people into facilities. And now we have a team of nurses working virtually, covering multiple buildings. We aren't doing all the hands-on things that were part of Optimistic. We don't do that now. We're a virtually delivered model now. So we really had to pick and choose and transform. And there's a number of reasons we needed to make those decisions over time. But you can see this is a slide from one of our pitch decks, and you can see we cite, though, the Optimistic evidence, experience, the street credit that we very much earned in this space when we talk about who we are as ProBari. And what facilities actually see from us is a daily checklist of here's what you should do, of the issues and clinical suggestions that are found by the nurses looking through the medical record. So that's who we are. So we've gotten to do a lot of other cool things with the vehicle that is ProBari, with the business. So one big thing was all of the work that we did throughout COVID directly with state government to support nursing facilities and assisted living facilities, including supporting the National Guard deployment in nursing homes. So the governor announces that the National Guard will deploy in nursing homes. Immediately, we got a text about how can we be helpful. Over a weekend, we built a curriculum working closely with the trade organizations, partners at University of Indianapolis. And I mean, we just had to move very quickly. We were very nimble, and it was a lot of fun. It was a lot of fun. And so we've gotten to have some really neat experiences because of the flexibility of our team and the flexibility of having the business. So again, I know I'm trying to be respectful of our time that we gave us here, Malaz, but I think there are a number of considerations when you're contemplating a startup business. And I wanted to hit a few of the bigger topics. And again, these are areas where we can dive into more. Lawyers are going to have to be involved, to help you draw papers and to look over contracts and documents. And so you need some sort of support with that, even like right away up front. IP, intellectual property. So we're talking about taking research and spinning it up into a business or a related business. So that is almost always going to involve intellectual property that has been grant funded. And so then there are rules and guidance around how you deal with that based on the funder and based on your institution. And certainly there's a process here at IU. And again, we can talk about that in more detail if people are interested in. So for ProBari, for our example, ProBari has an exclusive license with Indiana University for all the intellectual property related to developed in Optimistic. Now, it is such an interesting discussion to be like, what is the actual IP? Because we didn't develop software in Optimistic. We certainly may have if we had started out differently, but we did not develop software. We do not have a drug. We do not have a device. And so what we have essentially are copyrightable materials, protocols, trainings, tools. So we have a whole library of copyrightable materials. That's the actual IP related to Optimistic. Okay, business, marketing, sales. Okay, that's just sort of this bucket of all the things that I didn't learn in medical school, right? So Russ and I are the leaders of ProBari, but we know that we have big gaps in what we know in terms of expertise with marketing and sales and all kinds of business acumen, right? Like we just don't have experience in that area. And it's really tricky to figure out how you get that. It's important to figure out what you don't have, because initially you don't even know what you don't know. And you start to talk to advisors, you start to figure out, oh, here are where our gaps are. And I feel pretty confident now that, we know where our gaps are. But the question is, how do you fill those? And you can do that certainly by partnering with a professional CEO, someone who's had experience in this space, et cetera. And you can, by strategic hires, by, partnerships with other businesses. There's a lot of different ways. So for example, we have a company that handles our payroll and our HR. So you can find a company you can kind of handle all those types of business functions. We have a financial accounting firm who does our taxes and keeps our books in order, right? So you can kind of hire firms to do these different pieces. So I think here's the tension. There's like all these things that you don't know, all these gaps you have, And the tension is, but nobody else cares about it as much as you do. Okay. And so that's where if you can find this person who's got this expertise and who will care about this as much as you do and put in the time and put in the effort and be on this journey, on this mission with you, that's the most exciting, that's the most exciting combination you can have. But also, and we have had some hard lessons with this. You can also, though, hire in people with business experience who may have a slightly different vision, who may, have different priorities, right? And so it's really tricky. And so right now you can see, I told you, like Russ and I are the ones running this company. I'm the CEO, he's the COO and president of ProBari. So that's the choice we've made. We are bringing in this outside expertise via consultants right now. Now, we know there will be a point in which we will make other choices and hire additional leaders and experience into the company. But right now, that's a choice we've made because that's where we are in navigating that tension. But it's certainly something we talk about a lot. And then fundraising. I think I'll just sort of mention fundraising. So if you're going to start a business, you can put your own money into it, you can put your parents' money into it, your neighbors, there's just sort of whole, friends and families, trying to get people to invest in your business. You can take a loan out from a bank. You can, and this is a pretty cool thing that we are well positioned to do in academia or as academic partners, you can apply for some grant funding. And I can go into more depth about the SBIIR mechanism through the NIH and have a few slides on that, but I'll table that for now based on sort of the interest in the room. And then you can raise money from investors. So ProBari has gone through a pre-seed round, a convertible note round, and we had an investor, IU Venture, so it's an IU affiliated but separate venture fund, and Regenstrief Institute also has invested in ProBari. The only other funding we raised, I'm not going to say it wasn't like, so we entered some pitch competitions in the state of Indiana and won. And so then that meant like, oh, now we've got more convertible notes in our portfolio. So Elevate Ventures is the state affiliated economic development venture fund engine, and Elevate has invested in us as well. We have actually, when you have a note like that, it can convert into equity in the company, or you could default on it, right? It's a high risk investment. Don't listen to that. But it's a high risk investment, so you could default on it if the company ended, or you can pay it back. And we pay back IU Ventures in full, and we are prepared to pay back all of our investors, and or it will convert to equity as the company grows. I'm going to stop there, Malaz. You don't need these.
Yeah, keep it this one, yeah. So these are the building block, I think, what Kathleen have shared. I'm going to tell you a little bit of a story, and then I'll focus on two things. So number one, we created 4 companies so far, and 2 of them ended with exit. So we technically finished from start to over. The last one was last year, we exited, and the one before it was in April 2022. Okay, we have now 2 still active company. One of them was started last January, so almost a year ago. We're struggling, we're pushing, we're in the process. It's a device company, so it has a little bit problem. And the other one, we just finished fundraising last April, and we were valued as a $42 million, right? So these are my experience. I'm not the CEO of any of these companies, right? And I'm more on the advisory boards, and a chief health advisor or chief health officer or chief scientific officer, but I'm not in the day-to-day operation of these company. And I made that decision based on my priority. Okay, so I just want to let you know. So that's the experience I have. All of our company has a tech as a big component of it. The one that is now valued as a $42 million was built on a book that we published. So networking is always crucial. And if you're interested, I'll tell you how a book become a company. Okay. So this is my background. I'll end with the last 5 minutes, and then we'll tailor to your question of 2 slides in my head that are big surprise for me. All right, they were very, very big surprise. One was developed, in my opinion, by Chris Callahan. But if you talk with Chris, he said, this is nothing. You give me the credit. I don't know, but typical Midwestern, never take any credit for anything. So I'll start with the Chris Callahan, and then I'll tell you what we learned about resource allocation. All right, like how do you allocate your resources if you want to make a huge impact? Okay, so the first one, I am officially addicted to impact, but I don't define the impact by the number of paper, the number of grant. I define impact by how many people actually receive the solution, and that solution led them to improve their quality of life or wherever they say. So that's a very, very different definition of impact. Okay, it's more close to public health impact. So if you ask Josh and other school public health, that's actually what they see. They see the number of life they have actually improved. All right, so we call that the public health equation, and Chris have modified it a little bit. So the public health equation of any solution is a product, so multiplication of 4 pillars. All right, one of them is effect size. You can put in accuracy, you can put anything. One of them is the effect size. We measure it like how many of the standard deviation of the mean measure, number need to treat, all this stuff, but that effect size, okay? But most doctors and clinicians, and primarily scientists, they think that's it, that's gonna be the impact, is how big is your effect size, all right? What public health have told us, especially in the past 4 years, that's just one pillar of an equation. The other one is the implementability of your solution, all right? The third one is the scalability of your solution. And finally, the sustainability of your solution, all right? So in a way, if you have an effect size like a PET scan that costs $5,000 a year to improve the recognition of Alzheimer's disease in this country, but its implementability is almost zero, scalability is almost zero, and sustainability is almost zero, your impact is zero. All right, and we know now the Amivet, for example, has been available on the market for at least 3-4 years. And yesterday I spent an hour trying to convince somebody to, an insurance to cover it. All right, our strategy, which is the last company that we just started, for the same problem, unrecognized dementia, using this public health impact, we come up with a solution. The accuracy of it is like 0.7, maybe in the best case scenario, 0.8, accuracy of differentiating cases or not. So very, very low. MRI or PET scan is like 0.98, all right? So we're like terrible. But guess what's the implementability of it? It doesn't require any time by a clinician or anybody, even by anybody. You just use the data left behind, okay? Second, scalability. It costs less than $1 per member per year, okay? Sustainability is obviously how we're trying to find a market piece for it. So I want to just mention this public health equation that helped. The second kind of building block we have, if you are really, really obsessed about impact, not just lip serving. There's a lot of lip serving in the world, all right? The way you measure people, how much they care, is by watching their behavior, how much they are allocating time, money, which they usually have control, after the problem they're trying to solve, okay? So if you are interested in solving a big problem for a large number of people, then you need to be very, very strategic in allocating your resources, at least your time. And there's usually the following buckets that have to put together to create an impact or change the norm. One of them is discovering a solution to fix that problem. So let's call that discovery, okay? But that's not enough. Then the other thing is packaging your solution. And you notice what Kathleen have done when she discovered the solution optimistic, then she packaged it in tech-enabled solution. Then the third one is distributing, implementing that solution. Some people use it implementation, but it's primarily distribution. So how are you going to distribute this? Where are you going to distribute? What's the distribution channel? And then the last one is marketing for that solution, sales and marketing for that solution. So these are the four components. What I thought prior to 2008, I thought I'm going to allocate 95% to 98% of my time for discovering a solution. And it's out of scope to package it, distribute it, everything else. The best way I can do is I can convert it to peer review paper, we call JAMA article, and put it on the bookshelf. And somebody else's job is to do that. And unfortunately, that did not work for my family even. Some of my family did not get benefit from that solution, okay? So what I find out later, it's actually the time allocation, if you are obsessed about impact, is maximum 5% on discovery. It's not zero, but 5%. Around 10% on packaging your discovery, and then almost 25% on the distribution and implementability of your discovery. And then 50% is on marketing, creating demand for people to knock on your door and say, I want this product. Because if you're knocking on other people's door and trying to sell your stuff, you are competing. Your chance of them open the door is very, very low, less than 1 per 1,000. Some people argue less, 1 in 10,000. But if people came over and knock on your door and say, Malaz, I want CHIS, the Center for Health Innovation Implementation Science, to come over to Michigan University, then I have a chance of almost 50% that this will work. So from 0.5 to 1 per 10,000, that's a lot of multi-folds pieces. So I'm gonna leave you with these two equations. Then Kathleen and we can zoom in to any question that will be value for you, because you might be very different than Kathleen and I. And if you don't give us any question, we will talk. I'll zoom in. Like I can zoom in like crazy.
We can do this.
Okay. We can start on the folks who are online if you want to, but anybody want to make an impact? Yes.
So.
Oh, wow. That's a barrier for distribution.
All right. So here's a conundrum that I think about quite a bit. Your 0.7, it's positive predictive value. I read your paper. So what do you do when there are now models out there that are at 0.85, 0.92? And do you give up your company and then advocate for these other people to have the better impact? Or do you keep pushing on yours?
This is really, really awesome. Great question. So in reality, so for me personally, to answer your question, I have Malaz Boustani's question and then the company question, all right? And they're not aligned, okay? So this is why for me, I don't want to be the CEO of company, because fundamentally I want always to be scientist, all right? So meaning accuracy is very important, even though it's 5%, but it's important. So to answer your question, I separate them. So for me, doesn't matter if this doesn't work, I will advocate for anything. But the CEO of my company, she knew that one, and she is already pivoting, and she's already creating partnership. She's already working some other stuff. So I'll give you example for our passive digital marker. Right now, she is teaming up or partnering with a biomarker company, the blood marker, and trying to be part of the chain. So instead of you sending $300, $400 per blood sample, how about if we make it more precise and use our passive digital marker to identify high-risk people, and then for that group we give them this and give them this. So she's trying to always to be agile to survive, to make the company survive. All right. The CEO who is not flexible that way and able to pivot, that will make the company fall down. Because most of these startup companies, they don't have amazing marketing strategy to, badmouth the people who perform out, and do all these they don't have that much money to overcome it. We're not like a beer company where the advantage of a beer company is not how good is your beer, is how marketing your strategy is, because there's really nothing different for that piece. So that's how I manage that risk. All right. But it's really, really tough for the CEO, because there's always possibility another solution will be better than yours. And, the conflict.
That's why it's kind of fun to have a startup, because I think you're pushed. You're not gonna be able to buy them out and kill it, right? And just promote yours. Like you have to compete. And like who you are, what your product is, there's nothing stagnant about it. I mean, we're constantly redefining and reshaping, what we do and what we provide to meet the demand out there. There are a number of different customers that we serve, and so we have to fit each of those segments of the market.
Yeah, and I think to build on the competitiveness, so what you mentioned, competitiveness, the competitiveness is again a product of how good are you in increase awareness and sale, and how advantage is your product.
Yeah.
Unfortunately, in the real world, the market is not gonna reward you for just solving a problem in a big precise if nobody know about it. So that's the tension too. As a scientist, we don't care about that type of thing. We don't care if anybody heard about it, because we are obsessed about the accuracy. In the real business, it's really market positioning, and it's coming over from the advantage, the competitive advantage of your solution and your marketing and awareness. Together, they'll give you ability to survive. Otherwise, the market will kill you.
Yeah.
Like there's a huge risk. I don't know if we told you, but like 95% of startup die within the first 5 years, just FYI. But her chance, she's been there for 5 years. That'll tell you something.
I've got a few questions. So if anybody, I'm going to ask one. If somebody wants to ask, I'll shut up and ask another. I'm going to keep asking until you shut me up. Kathleen, you've done your model does an amazing job of saving money for Medicare.
Mm-hmm.
What's your company's revenue model? How do you get paid?
Oh, yeah, I love there, because we knew this would happen. They're going to ask all the hard questions. So obviously Medicare should be our customer, and I've told that to them. And it's actually, it was incredibly frustrating near the end of the demo when they would say things like, "This is so cool, you're starting a business." I mean, they even CMS wrote a letter of support for foundation funding around starting the business, which they were like, we were even kind of joking about you asking them, but they did. That's how supportive they were. And I told them, it makes me crazy that you're so supportive when you could do this. And all the facilities would have optimistic. Like they have so much power as the big funder, but it's a slow moving mechanism. So Medicare is the obvious payer. So federal government, fee-for-service, that's slow. But of course, Medicare isn't delivered just in fee-for-service. Medicare is delivered through a whole variety of Medicare Advantage managed care products. So that makes the managed care companies potential customers. Who, frankly, we like as our customer is the nursing home themselves, right? So corporate chains who manage multiple nursing facilities, I would say that's my favorite customer, because that is closest to what we do and who we really serve and what our focus is and what our mission is. And we have spent a few years now keeping ourselves alive, right? Paying the bills and being able to pay our staff. But we have found that our growth path with just the nursing homes as our customers is not what we want. It's not the kind of company we want to be. We could stay in business. We could stay in business as a mom and pop consulting shop, and that's a business, right? But you talked about exit. Like when we talk about startups, we're talking about a growth trajectory, and potential exit event. That's almost what everyone talks about with startups, right? So anyway, and then of course I mentioned state government was a big customer for us in this very specific situation of a public health emergency. Our primary customer right now are insurance companies. I think they are the ones because it's who cares about saving the money on utilization. And at the end of the day, it's going to be payers. So managed Medicaid and managed Medicare are our focus right now.
Then how do you get paid? So you say this patient.
Oh, how do you get paid? Okay.
Something not happening. How do you get paid for something that doesn't happen? So
there's a number of ways you can structure a contract. And we have been charging, we've essentially been doing cost plus. So the simplest model, like, you're paying us for our time plus some profit built into that to cover our overhead, et cetera. So that's like our very basic model when we are working directly with nursing homes or we're pricing out for nursing homes. Now, especially as we get bigger and we feel comfortable taking on more risk, that's when you get into more of the value-based contracts. So you will get some money up front to do whatever service or to have access to your platform. You need, you want some revenue money that you can count on, but then you can structure with these insurers who will make money from things that don't happen, right? Utilization that's expected and doesn't happen. And then you can negotiate to share in that savings. We haven't done that yet. That is in the future for us, for sure.
My second question is completely different. It's, you both start out as clinician investigators, okay? You discover something that you think, hey, this actually needs to get out there and serve more people, and you end up getting involved in these enterprises. What happens to how you spend your time?
Yeah, well, and I think you
and specifically how you spend your time when your boss is an academic organization. So how does that work?
You go and
All right.
It's hard questions.
It is a hard question, and it kind of gets to that tension and hard choices around priorities. I've talked now, like, since I've kind of lived in this entrepreneurial space for a while, I've talked with a lot of colleagues at other universities, and I think it's harder some places than others, right? And I think it's harder at some places at some points in time than others, because the climate around, hey, doing a startup is really cool and this is so innovative, this is great, it can swing to, is that how you should be spending your time? Are those the metrics we care about? Like, you just in it for, profit or something, so I think the climate shifts, and it shifts, even within like a campus. So I will say, I feel like I've grown up over the last decade in an environment, well, really most relevantly in the last 5-6 years, in an environment that has been quite supportive and quite enthusiastic and sees ProBari for what it is, which is everybody's win. Everybody's win. I mean, it's IU's win, it's Regenstrief wins, state government, it's the nursing home industry. It is a win. And so that reality, I think, has really been helpful. But this is an extra. Okay, so I have a full-time job. Like, I have not taken a leave of absence, which is something you can do. You could take a full leave of absence or a partial leave of absence. But I have this strong team at ProBari handling a lot of this day-to-day operations. And I have a lot of very, very early mornings where I'm working on ProBari. So this is in addition. Now, one cool thing, which you did not ask about, but I mentioned this briefly, is something like an SBIIR mechanism that can help make it all make sense in terms of time. So an SBIIR or small business grant can actually buy out time to work on a specific project related to the business. And I have gotten to do that, but that's the only period of time during that funded grant where I had time carved out for ProBari.
And so before you get started, what part of your professional life, what fraction of that FTE is spent on ProBari? Just off the top of your head.
Yeah. 20%.
Okay.
Okay. But I'm starting with more than 100% in my bank here.
I appreciate that, but it's not 90%. It's
No, I would, and that's like, this has been really fun over the last year for me, where I'm fully engaged in research and building my research career. I get to do a little bit of clinical. I've also gotten to do a bit of policy work, and then ProBari, this business enterprise, is very exciting. So I'm doing all the things. There could be a time 3 or 4 years from now where I pick and choose, right? And I say, now I'm going to completely do this, completely do that. For example, the policy piece, I have stepped back from just in these last few months to manage potential conflict of interest, because ProBari is working with insurers that are working with the state government, right? So based on the needs and opportunities of these different realms, and based also on issues like aggressive management of conflict of interest, which needs to happen, I could focus in one or another. But I've enjoyed this tenuous balance over these last few years.
So Bill, For me, to answer your questions very quickly, 0% of my professional time. So if you define
Yes.
50%, 50 hours work, none of it is taking care of any of these stuff. So that's one FYI. But before you do that, because of that journey, you have to really know authentically your why. And for me personally, seeing my father-in-law who died from Alzheimer's disease and other related dementia and not getting benefit from the model of care that we develop in Ashkenazi, and seeing what happened in Ashkenazi, that we were not able to expand it, forced me to look in the mirror and say, look, whatever you've been trying to do before, it's not working. If you can't even help your father-in-law, how are you going to help other people? So my why, it's very, very important for me to do the impact. But in the same time, I know what I want. I want to be scientist first, but I want to be an agile scientist, a scientist who will not going to be just addicted to grant and paper, who understand no money, no mission, right? But there's addiction, right? In that perspective. So I knew my identity as a scientist. That's the case. So based on that, I created hard decisions. So the first hardest thing to do is not to be the CEO of the first company and let control. Like it was so painful, like picking up a CEO who was willing to come over and live off potential. That's very, very rare. We didn't have enough money in the first company to pay the CEO, and then watch that CEO make decision that I thought it wasn't good decision for us, but that's what it is. So I decide to be out of the operation from the beginning and trying to be more an advisor and work with the IU side. The other thing, based on that background, I've been allocating my time very, very differently. So I've been allocating my time toward a problem that you need to fix in scalability and sustainability. So I've been choosing writing grants that go after that problem. So I've been selective of what problem I need to do. The second thing I've been doing a lot of networking for discovery. So I spend a lot of my time looking around, discovering other people, talking things. And the third thing I do is mentoring the next generation, in my opinion, of the agile scientists who are going to be obsessed with impact like myself. But to answer your question, 0. Because of that, I don't look at the paper, on the company as a way to give me revenue right now. I look at it as more like a big possible, very low probability of success, but if you succeed, like winning the lottery, right? So I set up this way. If we have the exit, then we make the money. All right. So that's been how I try to make it up.
Follow-up question, you have equity in the companies that?
Yeah, all of them. But I reduced because of that piece. Instead of having 55% equity, having control, my equity is very, very low. All right. And I have no control, but that's the trade-off that you're trying to do.
Okay, I'm going to keep asking questions.
I have a couple questions just from the online, real
Okay.
quick, that kind of feed into what you've been. When the intellectual property is based on publicly available information from NIH-funded studies that have been published, what do you really have to protect? And both of these comments are from Vijay Ramakrishna. And the second one is, how do you separate work? Separate the work you do on your own time. I just had an alert pop up, sorry. From your IU job where there is limited overlap, but the academic institutions always claim they are enabling your success and developments.
Well, let me go with that. These two questions, relatively easy. So you map your week, all right? So IU technically doesn't owe your Saturday and Sunday, all right? So that's number one. So I always try to prioritize Saturday and Sunday for anything there, even though I've been spending my Saturday and Sunday once a month for the graduate certificate. But I do that one. And then usually they don't owe you after 5 o'clock. correct? So theoretically, all right? So you have to create a boundary on that piece, and you have to make sure you don't use the resources of IU and everything in trying to figure that out. So you map your day, and you figure out what's the boundary within the compliance and everything else, what's the flexibility. And based on that, you need to make decision. For me, there's no way I can be CEO or COO or an operation because it's gonna consume a lot of my time in the beginning. So that's one piece. The other piece about IP stuff, number one, know your limit. So know your limit about intellectual property. Number two, don't over confidence with IP based. Walmart and Walgreens, they don't have that much IP. So there's something called service and there's something called product. In the service, your money advantage is speed of dominating the market and getting in. All right, where the product, where you have some IP things, is very, very different. So my strategy has been always using more of a service concept, technology enabling, and not much really big IP. We do IP just for the purpose of giving, at least for us, a purpose of giving, make it hard for other people to beat us or take our stuff and then lip serve it and badmouth it. So our IP is just to make sure no one use this model and then they they do it not the right way, not in the big way, and then they badmouth everything else. So that's been our strategy, service-based companies, which is very different than academia where they have primarily a drug, like a product. And even now with the tech, you have software, but even software is in a copyright and it's very, very hard to really replicate it. So it's much big difference. We got lucky that we had a lawyer who knew that kind of stuff from IU, so made sure it stopped our delusion, and made us like, look, it's all about operations, all about marketing, it's all about sales, it's all about speed, and don't be too greedy, in a way.
I mean, again, there's so many ways we can take a lot of this. And I don't want to get too far away from some of the things you were asking, because there are a lot of leaders in this room. And so how do you want people to manage startups? How do you view them? What are the pitfalls, but what are also the positives around it? I'd love to hear that for some of the folks in the room that I'm looking at. Sean's not making eye contact, but I'm looking at it, right? But I think that it has to be a conversation, right? Like any of us, on faculty, we can just go, start all these other activities, related to our research work and not be in communication with our leadership. But I've had a lot of those conversations over time, but I'd love to hear your input on that.
Well, if those of you who are old enough to have been around when I was president here, we recall that we had an investigator's self-evaluation form that we sent out, and that the highest points you got for that was impact.
Mm-hmm.
So and that wasn't the way it started, but we revised it because we said just what Malaz says: if this stays on the bookshelf, cares?
Yeah.
So I would have said a little bit differently, but who gives a care? And so I would see somebody take something like this and launch it as a company that's actually implemented this nursing home. I would give that a very high score for that. I give academic credit for that. And I think, with the CTSAs and something like that, the world is beginning to see that you're talking about T4 translation, which is the weakest part of all the CTSAs. So you make something strong, which is the ultimate goal of the whole CTSA NCATS environment, and you're actually doing it. So we gave great credit for that. I think other institutions start to provide implementation science and stuff like that are beginning to take real world applications and saying these are the end products of academia, and academia should give it credit. I think that's happening more widely. It was certainly happening here. I don't know if it's happening now.
Yeah, just to build on that. For my journey, I was there when Bill was here. So the Regenstrief Institute and even IURTC, used to call IURTC, the people who I reached out to, Bill, obviously in the evaluation, he has that impact. So I was one of the people who filled that evaluation, and when he tell you it, I felt it, I got credit. And at least for sure, I didn't get like, don't do it. It's the opposite,
Right.
like do this some stuff. In IU RTC, they also gave us a lot of input and a lot of insight, a lot of talk about that piece. I think the struggle we had, at least me personally in the beginning, it wasn't from the institution and from IU institution, it was the peers. The peers early on and almost some of them were really so ironically judgmental and righteous, which I can rip them apart how they are not doing what they're talking about. But anyway, they made me feel like I sold out. All right. And that was very painful, but thank God for my support group. You know, every week I go to the support group, I talk with Bill, you know, and he remind me of that impact equation. Chris Callahan was amazing to let me do this. And both Bill and Greg Sachs and Chris were kind of like, I call them the bodyguard, you know, like, you know, the tackle. When you need somebody, Greg was like, to make sure I don't go off the tram and get collided and die. So he was always trying to protect me there, and Bill and Chris. So the painful thing for me talking about infrastructure was really early on when it wasn't cool, people thought we sold out. And that was very, very painful from people who you respect.
Great. Well, I made a comment and we'll get a little bit at your question, Kathleen. So, but first, thank you for doing this. I think this is great to have an open conversation about this important topic. And I think that the impact is a theme that we have at Regenstrief Institute. We've recommitted to that in the new strategic plan. And what you're doing is highly aligned with impact. And we want to see that. So I think it's a great model. And just really congratulate you both on what you've done so far and that pledge to commitment to having that impact in your work. And I think that's what makes us unique at the Regenstrief Institute is going beyond some of that academic mission and being able to really advance that impact mission. So I guess then a follow-up question would be, I think for many of us in the room, it may be we're thinking about, okay, well, how might we think about the work that we're doing in the Institute and consider what might be an opportunity to move forward and commercialize? How do you know when you have something? Where do you start?
Yeah.
Thank you.
I was actually kind of thinking that in some ways we're kind of the extreme case, right? And I think that there are a lot of opportunities. I think there are a lot of missed opportunities to commercialize, to get products, services, ideas developed on the research setting out, into the marketplace, into more, widespread implementation. And you don't have to found a company to do it necessarily. You can find, strategic partnerships. You can, you can find a company that's doing something similar and see if you can work with them to improve, augment what they're doing. I think there's just this whole range of options. And optimistic where we started is there's a tough problem, in terms of consistency and quality of care in nursing homes. You can't spend much time in that setting without just feeling it in your core that, there are big shifts that need to happen in that setting of care to get residents and families the type of support that they need. And so, we started with our evidence base, right? And so then we had this thing that worked, and so I kind of talked through that journey. If we started optimistic now, so many things I would do differently. But one thing I would do differently from the very start is be thinking about what's next. And so to do that, you have to understand, who would buy. Your first question, who the heck is buying what you're doing? It's nice that you're helping people, but who's going to pay money for that? And that's the kind of exploration work that you can be doing during the grant, understanding what the priorities are of the different payers and how money flows. So yes, we reduce hospitalizations, and I can explain to you why a nursing home executive director cares about that, but it takes me 5 paragraphs to do it. It's just too many lines to connect. And so that was never going to be our primary customer. It took me a long time to get there. If I'd been asking those questions from the beginning, I would have already known that by the time the optimistic ended. Yeah.
Oh, I think Rachel is so what can you do to leverage what we have?
Yeah.
Number one is Regenstrief is very, very unique in difference. So if you, the best strategy is to create what we call incubator. But what happened, people use incubator from a very different perspective that is not aligned. We need an incubator for health services research, maybe software development, a little bit. We get incubator that are used to pharma, like a drug-based, or they use for a patent that a machine or a device. So we need an incubator. And the big thing in the incubator that is missing is two things. Number one, continue these kind of conversation, these kind of storytelling that Susan kind of like twisted our arm, honestly. But I just want to let you know, like, I don't want to give another talk. But Susan, you know how she does. She make you feel really like, hey, walk the talk. Not like she call you when you don't walk the talk. So Susan may start this conversation. We need to continue that conversation. We need to create an incubator to help, and we need to let people know what's the journey is so they can make right decision. And the big one is relevant are two things we don't learn is what is your story, because that's the story you're going to convert to pitch that will raise money. What is your pricing options? That kind of piece, and what's your market entrance for health services research model of care. And so the NIA, has created something like that for entrepreneur. This is now, they are looking for the third lawyer, focus on minority. So underserved minority who want to be entrepreneur, who want scientists help them, and they created some type of incubator and support, and they have a $60,000 price later, and they help you with the SBIIR and SBIIR. So there's other venue for NIA that can help, but I think for us is continue the conversation and create a special incubator for our need, not just copy and paste from another group.
Yeah, and I think the other thing is, it's like, you have so many questions along this journey, and just, increasing your network of people that you can ask questions of. And like, even, there's, a professor in Bloomington in chemistry that I've called a few times, right? Because he's started different businesses, just like reaching and, with, friends of friends and connections of connections, and kind of digging deep into the really rich environment that we do have here. So. Yeah, I know there's questions online. I'm sorry, I know we're at time here.
This is just really a quick one, and you've already touched on it somewhat in previous answers. Gerard Dreesen Hills is asking, I want to know more about how you all felt your departments and colleagues have interacted with you, knowing that you were involved in startups. Did it affect collaborations, which you've already addressed? Does it still affect collaborations?
Now for us actually does affect collaboration now, but it's speeded up. So it used to be barrier. Now people, they can't tell, we have now track record, all right? We have that we didn't abandon one mission on the expense of other mission. We have exit strategy. So now it's actually the opposite. Right now, our major problem is how can we share this experience? So for the person who asked question, contact Iana Buchanan, fight for your time if you want to zoom in to talk with me. And I have a rule of thumb. Anybody reach out to me, I'll give them always the first 30 minutes for free. Just
and that's the note we'll end on. Thank you guys. Thank you so much for having us.